Well, as a Texan living in France, I can really look at it from the point of view of liberty and state. But I'm going to speak most particularly to healthcare, which is the area that I've been concentrating on in the past 5 years. And in France, most people think that it's the one thing that's right in France. But is it? Because for the time being, it seems rather enviable. Life expectancy in France is very long. Patients have a high satisfaction rate compared to many other countries. There are high reimbursements for pharmaceuticals and relatively good access to care overall, although it's limited in certain areas and in certain specialties. There's a mix of public and private care and a patchwork of alternatives. 65% of the hospital beds in France are public, 15% private non-profit, mostly for elderly care, long-term, and about 20% by for-profit companies. But there is a looming problem. As Edmund Burke said, a state without the means of some change is without the means of its own conservation, and France lacks the means. The shortfall was over 12.5 billion euros in 2013, although, of course, the health minister, Marisol Touraine, who unfortunately has been kept in Manuel Valls' new government, congratulated herself that this was less than the 13.3 billion that she had anticipated. And so the government wants to reform healthcare to help reduce these shortfalls. And well, they should, because many public hospitals are run with little regard to efficiency, and there is certainly waste. There's overconsumption. France is number one at something. That's in popping pills. And the government is forcing, of course, those French pill poppers to rely more on generics because it will cut costs, whether they like it or not. However, once again, it's the government that's part of the problem. There are 43 regulatory bodies and a massive bureaucracy. Just to give you one example, if a hospital or a clinic wishes to purchase a major piece of equipment, you can only do so with government authorization. It's not a certificate of need. The authorizations can be difficult to obtain because the government decides how many it will have per population. For example, in the Île-de-France region, it's a policy of the government that there should only be one PET scan per million inhabitants. And even if you believe that over-testing and over-prescription of exams is a problem, France errs on the opposite side of the equation. It believes that if it limits supply, it will limit demand. Well, at least it limits access. But at what cost? Because if you're undergoing chemotherapy for cancer treatment, for example, you want to undergo a PET scan to help determine if your treatment is working. Because if it's not, it's better to try something else or perhaps stop it altogether. This is penny wise and pound foolish on behalf of the government. There also remains the problem of what we call healthcare deserts, which are underserved areas where people must travel long distances to receive care. In certain specialties, it's particularly egregious. It follows trends in French healthcare, for example, which include the disappearance of what we refer to as médecin libéral, the private practitioner, once a standard feature in the French healthcare landscape. In the Paris region, the number of private generalists has fallen by 20% since 2007, 16% less private practice gynecologists, and 4% less pediatricians. And if you notice that the average age of the Parisian gynecologist is 60 years old, you begin to see that there are additional cracks in the facade. These trends are not surprising to those of us who work in healthcare, because first of all, the government rate of reimbursement for a consultation is 23 euros for a generalist, 25 euros for a specialist, a little bit more for a cardiologist. That is in Sector 1, which is the government reimbursement rate. Sector 2 allows for overages of 2, 3, 5, 10 times that amount, but the current government is trying to cap it at 2 to 3 times the government rate. Sector 3 is the freedom to charge what you wish, but your patients will not be reimbursed. There's a feminization of the healthcare sector. 60% of medical students currently are women. By some studies, this means we'll have a majority of female physicians by 2022. And of course, I'm not against women in healthcare. Au contraire, I think that's wonderful, but it must be understood that this will have an impact on availability. Because female physicians, on the whole, wish to have a greater work-life balance, rather than the round-the-clock availability that sometimes is required of current private practice physicians. The average female generalist in Paris or in France works 6 hours less per week than their male counterpart. And this is a valid choice, of course, but if you extrapolate this out over half of the available positions, you'll see that, of course, this must have an impact on availability of care. What it boils down to for both the healthcare deserts and the diminishing number of physicians is that, well, big surprise, the rules of economics apply. Incentives matter. And if you enact price controls, you will either affect quality or quantity. And the incentives are insufficient in France, and price controls are affecting both quantity and quality. If you combine this with a reimbursement structure that's fee for service, you create inefficiencies and waste. Making money relies on prescribing tests, performing procedures, and it does not put the emphasis on where it should be, which is outcomes, on health, on maintaining well-being. All of this provides a snapshot merely of where we are. The government plans to tinker a little bit around the edges with the mechanics, but not completely overhaul the system and change the focus. And I believe that the best way to overhaul the system is to remove the barriers the government puts into place and to encourage innovation. Unfortunately, in France, innovation is something for which we are ill-suited with our centralized approach. And don't get me wrong again, France is very good at invention. We have great technological projects, very brilliant people, scientific research, but the synthesis of that invention with process and bringing it to market, the entrepreneurial approach, not so much. But that's a whole nother discussion. So what kind of invention and innovation can we expect in general in healthcare? Well, one of them is telemedicine, in which a physician can consult at a distance from a patient. Robotic surgery already exists, which can also be done at a distance. Medical tourism, where the patient is a true consumer shopping for the best prices or best conditions or novel treatments unavailable elsewhere. And then we come to greater patient-physician wellness collaboration. Currently, a patient decides to go see a doctor or head to the hospital when they feel ill or something is already wrong, or perhaps they've heard at a certain age they must undergo certain exams. This is inefficient. It's much as if you waited to service your car only when the tire blows out or when the gasoline needle is on empty, rather than on performing regular maintenance. So instead, this approach puts the emphasis on maintaining good health and avoiding illness in as much as possible through a strong primary care or preventative medicine relationship between the person and their primary provider. If a relationship of this kind is in place, there are fewer visits to the ER, a lower need to see specialists, fewer surgeries, and then naturally costs go down. And there's several ways you can achieve this. One is through what we call innovative practice design, like direct primary care, which removes insurance from the equation. Why do you need insurance for these kinds of visits? After all, let's go back to the car analogy. Imagine if you have insurance for filling your gas tank, or changing your oil, or replacing the wiper blades. That would seem rather silly, wouldn't it? It's much the same for health maintenance. 90% of the visits to doctors are primary care. So if you can save that insurance for catastrophic care or inpatient hospitalization or expensive procedures, there's a cost savings automatically. And the physician is thus freed from the time-consuming and costly burden of filling out endless bureaucratic forms that take time away from the time spent with the patient. It can take a membership fee where you pay an annual fee to establish the relationship with the physician. It can change, and there's concierge medicine. It has all kinds of varieties. The doctor then better knows the patient and the patient's needs and can tell when something is out of ordinary for the patient. And a way to improve upon that approach is by factoring in something we call the quantified self. What's this? Well, with regards to healthcare, there's a movement to use technology to acquire and amass data about oneself, a lot of data, about daily routines, sleeping and waking times, meal times, physical activity, blood pressure, glycemic index, oxygen levels, and all kinds of other inputs that we can then use applications and computer programs to quantify even our own genetic data. Wearable devices and apps, you can wear them to monitor your health, for example, Fitbit. And there's another one called the Scanadu Scout, which is really very cool. It's kind of like if you've ever seen Star Trek, a little sensor where you press it over your body, it takes all kinds of things. This pretty much does that. It does temperature, blood pressure, heart rate, ECG, etc. In any case, you put the ability of the person to collect this data into their own hands. It allows them to choose what they then share with their physician. The physician can track this remotely through a dashboard and keep records between visits, and those visits become then more productive. For example, the elderly maintaining and monitoring their own information daily from their home, and anomalies become spotted before they become problems. These are just a few ideas, but I believe that the key to new pathways in healthcare lies in putting more power and choice back into the hands of the individual consumer, removing barriers to innovation, and above all, in removing the role of the state between the patient and the physician. Thank you.